Welcome to this edition of COVID-19 updates from the Center for Practical Bioethics. I'm Linda Ward, and our guest today is Dr. Jessica Kalender-Rich. She's a physician based at KU who has been on the front lines of COVID-19 in nursing homes. Dr. Kalender-Rich, thank you so much for joining us and taking precious time with us today.
Thank you.
So you've been doing this a long time. How does this latest challenge compare with anything you've ever seen in your career?
You know, we have seen challenges in the long-term care setting. We've seen influenza outbreaks. We've seen really rises in other multi-drug resistant organisms, just like in every setting. But this is different. And it's different because of the numbers. It's different because of the risk. It's frankly different because of the mortality. And more than that, it's different because we don't know enough about it to make decisions based on how things were done well and done poorly in the past. So we don't have a good way to inform our current, aside from just looking at the last few weeks and months around the world.
So give us a couple of examples that you see daily that you would like people to know about how this is different, about how nursing homes and their residents are doing during this pandemic with so many unanswered questions.
Yeah, you know, I think there's some anxiety amongst people who live in nursing facilities and the staff that work there. And again, it's this different sort of anxiety of not knowing. But I have seen some amazing things. You know, we hear all these stories about medical professionals in the hospitals really stepping up and being families of residents, of patients. In long-term care facilities, the nursing teams are often already the families, not in the traditional sense, but in the sense of the people they see every day for those residents. And so it's a nice sort of way that they can easily step into the role of continuing their support for the people they've cared for a long time and do it without disrupting their sort of normal patterns. Now, there are disruptions. So in the facilities where we normally had everyone in one room eating together and playing cards and watching movies or whatever that may be in that facility, we're not doing that anymore. And that's hard on the staff. It's hard on the residents too.
Sure.
They have lost some of that structure. And so the facilities are really working hard to provide structure in a really different and often unique and innovative way.
At the Center for Practical Bioethics, we talk a lot about the importance of having the conversation before there's a crisis, talking with your family members, not just for nursing home patients or residents, but for everybody. Let's talk about how having the conversation is important now in nursing homes and how you're accomplishing that under these difficult circumstances.
So having this conversation has always been important. It's going to be important 10 years from now and 20 years from now and way after we have gotten a handle on this COVID-19 crisis. And it's important that, you know, we have it early, like you said. And so we have really encouraged facilities for whom, you know, I have contacts and our group has contacts, and we've actually made collaborative efforts for a lot of different physicians and advanced practice providers across a lot of different groups providing care in facilities so that we can all have the same goal of getting advanced care planning done in the setting of COVID. It does look different. You know, these conversations are not the type that you can buzz in and buzz out. And a lot of us are restricted to the number of facilities appropriately that we're walking into because we don't want to bring anything into the facility. So we're doing a lot of teleconferencing, much like this, using Zoom or other platforms. And the truth is, it's kind of nicer because now I have the resident and the nurse and myself And I also have the daughter in California and the son who's at his office and can't get away, and we can all see each other. And at least in my area of the country, we haven't really done that much. It hasn't been part of what has been allowed. Um, and I've seen a lot of benefit from it. So we're having those conversations. We're having them when people don't always expect them, though, because we want to be prepared. And that's what we should be.
I think I know you and others have been so helpful in training people to have these conversations and participating in webinars so that through the center and maybe other places to help people learn how to have these conversations. You're extremely experienced doing this. You've been doing it for a long time, but you can't be everywhere. How could you kind of describe how the conversation begins and how it goes for someone watching this conversation who might be helped by it?
Yeah, I think a lot of us who have these conversations have our own way of doing it, and we really should. I always tell learners that they need to have sort of their back pocket method for these conversations and a back pocket phrase for breaking bad news, two separate things. And that's because they're hard conversations. And to have a hard conversation, you really have to have foresight and frankly practice, even if it's like looking in a mirror and practicing how you're talking to people. So it's important first to sit down with whomever is in the conversation and really figure out what they know. It's critical. I mean, I need to know what you know because frankly, you might have information that I don't, right? So the family might know about the person's cancer treatment, and I might not have any idea what's been going on in the last 2 months behind the scenes. And that all plays into how the conversation looks. So gathering that information and then frankly having an open conversation that uses words that we all understand, so that we know what that person's goals are, and then the medical team can take those goals and extrapolate to the medical orders what that looks like and discuss those with the family. That's really the key.
Yeah. So as we wrap this up, what advice do you have for families with a loved one in a nursing home right now?
Yeah, patience, number one. We all want to get in there and see our loved ones. We get it. I get it. The nurses get it. The patients get it. Everyone's trying to protect the residents in the facilities. So patience, waiting for this to be safer. Innovation is really important, right? So the nurses and the social worker and the people in the facility, they should help you be able to communicate with your loved one via FaceTime or Skype or whatever works for your family. There's a lot of creativity happening right now to help people communicate with their loved ones. But the other thing I think that's important is communication with the staff. So we need to be asking our staff to call and communicate with the families and give them updates regularly, and to help coordinate that communication, because communication is the key really to providing good health care, but also to providing good person-centered, person-focused quality of life care.
The thing we all want the very most. Thank you so much for taking time to be with us, Dr. Jessica Kalender-Rich, and thanks for tuning in.